Welcome everyone to our January guest speaker event. We'll get started in a few minutes, so feel free to say hi in the comments.
Welcome, Welcome, Alliance hosts and members, to our January guest speaker event with Dr. Naravala. Good evening, and I'm Anushka. And just to introduce myself, I'm one of your committee leaders, and I'm thrilled to be here tonight.
Hey guys, I'm Didipia, one of your sophomore councils, and I'm also excited to be here with you guys and have everyone meet Dr. Naravala. Just as a reminder, we are going to have our QR code for attendance at the very end, so be sure to stay the whole time. Before we begin, I'd like to briefly introduce our CTSO organization to any of our new members. HOSA is a student-led organization that strives to prepare students to be the future of healthcare. Through Alliance Academy's HOSA chapter, we bring monthly guest speakers to our chapter members with a wide range of specialities from around the globe.
Without further ado, tonight's guest speaker is Dr. Naravala, and on behalf of Alliance HOSA, we welcome you with warm and wide arms. Thank you so much for joining us. We are truly honored. We will be starting off with the discussion, and we'll have the opportunity for members to ask questions towards the end of the video. All right, so that means the floor is open for any questions at the time. So make sure you type them in the chat box and make sure that you keep consistent with it. Dr. Naravala, why don't you begin by introducing yourself and telling our members a little bit about your field?
Okay, yeah. Hello, everyone. This is Dr. Janaki Naravala. I'm one of the hospitalist physicians currently working at Northside Forsyth Hospital. I'm board certified in family medicine, but I'm currently working as a hospitalist here. And just a brief overview, like I went to med school in India. I did my MBBS in India at Narayana Medical College in Andhra Pradesh. And I moved over here to US right after I graduated. I completed my USMLE exams, ECFMG certified, and I did my 3 years of family medicine residency in Indianapolis. And after that, since my graduation, I've been working as hospitalist, and it's one of the field I really like, and I really enjoy what I do. And that's where I am.
So, what are your thoughts on the internships in your field? Is there anything that you want our members to know specifically about your field that separates your field from other medical specialties?
Sure. So for most of you that haven't heard about hospitalist, I know it's been there, but it's kind of new too. So hospitalist is one of the primary care specialties that are more specialized in taking care of acutely ill patients when they are being admitted to the hospital. And I'm still a primary care board certified physician, but I gear my practice more towards hospital medicine, where I will primarily be working in the hospital with different schedules. You know, there are a lot of schedules, but it's primarily working in the hospital. My schedule is week on, week off. I work 7 days in a row. And I get 7 days off, which is basically I'm working 6 months a year and I have 6 months off. But when you are on, you are working weekends too. And you're working holidays. If a holiday falls on your week on, and you're working that weekend or that week. So that's where hospital medicine specialty is. And regarding the internships, The place where I work at Northside, we do have a lot of internships, and there are pretty good programs. So there's a program called Volunteering Program. It's for kids who are 16 above. They can apply for that program. You can come and volunteer at the hospital during summer months, which is like more flexible time for you guys, and you can explore areas in around the hospital. And there's another program called Healthcare Explorer Program, which is basically the kids will be rounding in multiple variety of units. Like it's, I mean, just looking from outside, it's a hospital, but if you enter, it's an army of people, like army of specialties inside the hospital that you can explore. And you can come watch departments that you're assigned to, like, you can come and watch the hospital medicine, you can come and watch like surgery, pulmonary, ortho, cardio, like radiation oncology, radiology, like, you just to get the gist and feel of every specialty in the hospital. And you can also work with nurse practitioners, physician assistants, and a lot of technicians. Like I said, it's an army of people in the hospital that you can get exposed to. And apart from that, we have work-based internships for kids. So you come and get your work experience, like, just kind of like shadowing the physicians, kind of like get to know their day in, day out, how the day is going to be for them. So just like bread and butter cases in the hospital.
What are some of the biggest challenges that come with your career?
Um, the challenges we face are, yeah, number one is when patients come to the hospital, to the emergency room, most of our patient population is geriatric population. Um, so sometimes they come into the hospital with, they're so confused. They're not able to give any history to us, so we're totally relying on patient's family. And most of the time, patient's family doesn't know what's going on with, like, what's everything going on with the patient. So it's hard for us to, because we are not established, we are not a primary care physician in the clinic where, like, you have a rapport with the patient, you have seen them multiple times before, you know something about them. But when they come to the hospital, when they're totally confused, they're not able to give us any history. So it's hard for us to um, maneuver the plan of care to see which way to go until we get more information. So I feel that's a little challenging at times. So the other challenges we face in the hospital is it's not just taking care of patients, right? Um, we kind of develop a disposition plan. So when they come into the hospital, we have an idea of how long they're going to stay in the hospital, what's their medical diagnoses, and how long it's going to take for us to treat the patient. And we develop a disposition plan, like, we ask physical therapy, occupational therapy to evaluate the patients to see how their balance, gait, if to see if they're safe to go home or if they need to be placed in a subacute rehabs or acute rehabs. And we are waiting on insurances to approve their stay at the facilities, and it may take a longer time. Like, even though I, as a physician, am done with taking care of the patient, that their medical problems are all resolved, and they're still there in the hospital just waiting on some approvals, authorizations. They're just taking up a bed where it could be used by somebody else who is really sick. So sometimes I feel like that's the most challenging part too.
So, adding on to that, what are the most common types of cases that you've had to endure?
Right. So we see a wide variety of cases in the hospital. Like, you imagine any specialty, everything is in the hospital, right? So right from like head to toe, like, you see strokes, you see like strokes, two different types. It could be ischemic stroke, it could be a brain bleed and a stroke. And we see heart attacks, heart failures, pneumonias, COPDs. And if it comes to gut issues, like, people come with diarrhea, small bowel obstructions, GI bleeds. They come with kidney failure, oncology issues, gynecology issues. They come with falls and fractures, like anything you name it. We see that in the hospital. Yeah.
What's your favorite thing to do in the hospital?
My favorite thing to do in the hospital is help take care of patients. I mean, basically, we see most bread butter cases in the hospital, pneumonias, falls, fractures, strokes, heart attacks, heart failures. Um, I like being that primary care advocate for patients in the hospital. So when they come to the hospital, they're in a most vulnerable position, right? They're super sick. They don't know what to do. So they're primarily relying on the doctors to tell them the right plan of action. And sometimes it may not be, medicine is not black and white. There's a lot of grace in medicine, right? So when they come in, it's not straightforward cough, cold infection, cough, cold pneumonia, right? It's not straightforward pneumonia. They may come with like 4 or 5 problems at the same time, and everything could be interlinked. And when things like that happen, we have to involve multiple specialties. Like, a patient may be seeing myself as a primary care physician in the hospital, and they will be seeing a cardiologist, neurologist, and a nephrologist. Like, they will be seeing multiple people. They get super overwhelmed with what's going on because everybody come and say multiple different things. So my job as a hospital nurse and physician is to kind of concise everything and explain it to the patient in a way that this is what's going on with you, this is the next step in the plan of care, you may have to stay in the hospital for this reasons, and help them understand, just to just come up with a good plan of care, and help their families understand what's going on for them, just to ease their mind and put them at ease.
So, if you were to go back in time with your profession, what's something that you would change?
I don't think I would want to change anything. I'm pretty happy with where I am right now. So I was always debating, well, let me go back in life again. So when I was in my med school, so I was the only physician in my family, the first physician in my family. So a lot of people like come to me, like, just my immediate family members, like, they would come and ask me for help. And even though I wasn't like, I was just a student doctor at that time, like I'm no good in any specialty, like, I just know as much as like any others do. But I'm there chaperoning them, just helping them figure out like what needs to be done for them. And in that process, I learned a lot, and I wasn't restricting myself to like any one particular field. Like, I was helping everybody. Like, I had that gratitude and immense gratitude in, helping everybody. So that's where I was. And still, I don't have any specialty in my mind at that time. Like, yeah, I like medicine for this reason, but I never picked any specialty, or I was never dreaming of any specialty at that time. So I'm done with med school. I came to United States, and I started working. Well, I finished my USMLE exams and ECFMG certified, and I started working as a medical assistant. This is me before residency, and that experience has helped me a lot in gaining knowledge about like what's going on in the healthcare setting in the United States. So after that, and that experience really helped me getting into residency. And in residency, that's where I kind of like wanted to say I picked my specialty based on the experiences. Like in residency, you rotate through each and every specialty. Like, you have like a month ENT rotation, month ophthalmology rotation, month OBGYN rotation, like, ortho. Wherever I go, whatever rotation I do, I was imagining myself doing that specialty. And it was so hard for me to decide, like, so if I'm doing the OBGYN rotation, like, I love delivering babies. I love taking care of, like, gyne patients where, like, I do. pap smears and do IUDs, placing IUDs in them. Simple procedures. Like I was imagining myself as an OBGYN. And then I go to orthopedics, like total different specialty, right? Um, Usually, like not very many females would favor orthopedic specialty, but I was imagining myself as doing ortho, like oncology, everything intrigued me at that time. So then I decided, I think I should stick to just doing everything. I can't focus on one particular specialty. So that's when I started to narrow my choices as to what I like and dislike. And based on my likes, I think I wanted to be a primary care physician. So then I still have two options. So primary care physician doing outpatient versus primary care physician doing inpatient, which is what I'm doing right now. So primary care physician, just the experiences in residency. Um, I was pregnant with my second child when I was my doing my residency, and there were geriatric population. They used to crochet blankets, and they used to bring it to me. I love that aspect of it too. But this one patient scenario, where I really it's not like I enjoyed, but I think I like the acuity and the challenges in the hospital. You're constantly studying and you're constantly learning new things in the hospital. So this scenario I could remember very well. So I was on a medicine rotation, and this patient was complaining. So when I went to see, he was in severe pain, very severe distress. He could barely sit in the chair. He was in so much pain. And talking to him on clinical exam, I found that his abdomen was so rock hard, tender, and distended. It's pretty swollen and then it's pretty rock hard. So I'm trying to figure out what's going on, because I realized that I kind of have my differentials in my mind, what could have happened based on, patient's scenario. But a surgeon has seen a patient before me, just a few hours ago. And I'm like, okay, the surgeon saw the patient and everything was okay at that time. And now he's in so much distress. So what's going on? And I just did a simple test on him, just an x-ray, and found out that he had a bowel perforation, which is there was a leak in his bowel, which is a surgical emergency. He had to go to the operating room immediately. Within the next hour, he was in the operating room, and surgeons fixed his belly. Um, Everything was, nicely done, and patient recovered. And since that time, they were, I mean, that gratitude was so immense. Their family thanked me, so I was the one to save their life. Just diagnosing at the right time is very important. And that challenge, so I like that acuity and the challenges in the hospital setting. So I guess I told myself that I'll do hospitalist medicine. So here I am.
So, what recommendations would you give to high school students like us about what career they want to follow and how to help them decide what they want to be when they grow up?
Um, Even before going into the career path, right? It's very important for the kids to know what they want, what they like, what they dislike. They need to give it a thought about what are their strengths and what are their weaknesses. Um, they have to take time in exploring themselves first. So for me, I never thought that I would be in medicine, but I feel like I always had the traits of being a physician. Most likely, you should be willing to help people. Um, you should find joy in helping people, just doing some volunteering. I would say my advice would be explore everything while you can now. For especially being in a HOSA and just wanting to go into the healthcare field, I would suggest get as much exposure as you can. Like there are so many healthcare professionals and healthcare settings you can just volunteer and shadow. I mean, either it be like assisted living place or memory care units or skilled nursing facilities, rehabs, hospitals, outpatient clinics or multidisciplinary, like, multi-specialty group clinics, LTACs. I mean, there are like so much opportunity for you to explore and see if this brings joy in you. If that doesn't bring joy to you, or if you don't enjoy that experience, probably it's not the right path for you. Yeah. So I would say explore as much as you can while you can, like during your high school.
Yeah, as high school students, we don't really have a lot of opportunities, such as we wouldn't really know how a hospital actually works. So, high school students would watch TV shows that are medical related. So, is there any like connection between a medical show compared to an actual reality of a hospital?
That's a good question, but medical shows are so far from the reality. It's so far from the reality. I mean, as a med student, they do surgeries in Grey's Anatomy. That's not how it works. I mean, you barely get to go into the OR. You barely get to go scrub in the OR, like, just to watch a surgery. It's while in the medical shows they say like, you're a med student or you're like a medicine resident and you'll be doing surgeries. Like it's not going to happen in real life. Um, I'm sure there are a lot of opportunities. I feel like getting a mentor, like, I don't know if your school provides any physicians as mentors to you guys. At least they can see, I'm sure as kids, like, you guys are going through a lot of emotions, right? Like, you're trying to decide if you want to go into medicine or if you want to go into medicine, you're not sure if this is the right path for you or not. And even if you think it's the right path for you, you go into actual workplace assuming things are going to be fancy, like a movie show or a TV show, but the reality is not that fancy. When you go into the hospital, sometimes you smell all sorts of things when you're walking in the hospital, not necessarily pleasant smells. Um, and some people faint with by seeing a lot of blood, like, so you see blood and like all secretions in the hospital. Like, some people may feel it's pretty gross, but it's very important to explore. But I feel like if you can find a mentor who went through all these and could relate to your situation to see or give you some insight as to like how this is going to be for you in the future, you can get over this. I've been in that situation. Just some reassurance would help you so people don't deviate from the pathway.
That's awesome. So what are some common misconceptions in your field that you'd like other people to know about?
So the primary misconception for the hospital medicine is a lot of people feel like it's a burnout field. They think hospitalist medicine is people get burnout a lot. I don't necessarily believe in it. That's what I say. More than picking a specialty, you need to know about yourself. And if you know about yourself, I mean, you pick the right specialty, you definitely enjoy what you do. And if you enjoy what you're doing, there's a lot less burnout. And you have to balance your work life. You have to create a sustainable work life balance for you. You just have to work it out in a way that you're not burnt out. So that's one of the challenges we face in hospital medicine. Like we see a good turnover in hospital medicine because of that.
So, when you were studying in pre med, when you were doing medical school,
Mhm.
what would you give advice to someone that is learning about a field and they change their whole career goal? Like, say that they wanted to do gynecology, but halfway into somewhat their residency, they decide that they are interested in something else.
And I feel like it's completely okay. You don't have to know what you're stepping into all the time. There are lots of unknowns in medicine, and things can change if, but they're still in medicine. Like, they still have the main characteristics, like, being compassionate, being empathetic, and they're a good team player, they're good listeners, they have very good bedside manners. No matter what, you're still in the field of medicine. It's just specialty changes for multiple varied reasons, like their, work lifestyle, like, if they want more time off work, like, so there's so many priorities, their priorities can change anytime. So yeah, people tend to change their specialties, but they're still in medicine.
Mhm. One of our members has a question on how do you manage burnout in the medical field?
That's a very good question. Especially after COVID, we saw a lot of turnover, not just physicians, right? It's like I said, it's an army of people in the hospital. Like the nurses, especially from the nursing standpoint, there was so much burnout. Everybody overworked during COVID time. I think it's just that stress added to the burnout, resulting in like a lot of turnover. But how do you manage the burnout is you just have to find a work-life balance. So I feel, I think that will come with the experience too. I mean, initially it's hard, like any change is hard for anybody, right? So when you're starting a new specialty, when you're starting a new job, it's the learning curve is so high. And once you're off that curve, like, you get to know a lot of stuff and you know how to easily manage a patient. And when you come home, don't carry those emotions. Don't don't bring those feelings to home. Like, that's something, like, people have to learn, and it comes with experience. There will be a lot less burnout. Like, if you come home and you're still carrying the feelings that, because in the hospital we see a lot of challenges, right? I mean, so let's say my census is somewhere between 15 to 18 patients a day, and not all 15 or 18 are simple bread and butter hospital cases. At least 4 or 5 of them are pretty challenging, where that takes a good amount of your time. Um, and some people might be really sick where you have to send that patient to ICU. Some people may even die on you. Like, they code, and, you are in the code scenario, you're doing the resuscitation, and, so all the stuff. Um, And if you carry that heavy feeling emotions that, you were there, but you couldn't do anything to save the life of the patient, like, feelings like that would really hurt you in the long run, would cause a lot of burnout. So I think eventually, like, as you get more experience, you kind of like tend to balance your work life and family life, your personal life. Once you get that fair balance, um, there will be a lot less burnout.
Got it.
Mhm.
So, what does like a day-to-day work base look like to you?
So my work starts, I mean, we do different schedules, but typical day starts 7 to 7, 7 a.m. to 7 p.m. So we go to work. So some of those days we have to do early shifts, where I go early in the morning at 6 o'clock to relieve the night position. Um, and I do make a list for all the providers in my group. So once the list is made, so we start seeing patients. So every person has their own way to manage their day, and that's one of the reasons I like the hospital medicine, that you have control of your patient census. Like, outpatient wise, I feel there's not much flexibility, because, like, you're scheduled to see a patient at that particular time. In hospital medicine, you get your 18 patients for the day or 15 patients for the day, and you manage your time when to see the patients. You manage your time who's most important for you. So my typical day, like as soon as I go to the work, I print my census, like I print my 18 patients, um, and I go over each and every patient details. So some maybe, so let's say if my first day of the week, every patient is new to me. I have to learn each and every patient in detail. So it's going to take a longer time for me. But as the day goes on, like, by, so like I said, my week starts on Wednesday. But Thursday, Friday, I must have known most of my patients, like, I have a good rapport with them, like I know what's going on with them. But I may be discharging few people too, like, so on Wednesday, I discharge like three, four patients. And Thursday, I get three, four patients back again, like who were admitted the day before. So those are new patients, and then I try to learn them. So when I go in, when I review my patients, or based on like if the nurse has any questions, like urgent questions, like they would call me, I would make it a priority to see that patient first. So I manage my schedule to see like who's the most sicker on my census and who's like acutely ill. So I prioritize that one. I see those patients first, and I prioritize my discharges after that, because like you've got to discharge patients from the hospital so you can admit more people, because there are people waiting in the ER for a bed to so they can come onto the floor to be admitted. So I see the patients, like, I talk to their families, I discharge those patients, and then I make my rounds. So during my typical rounds, I review the patient's chart, I review their labs, I review any other consultant notes. So let's say if this particular patient had like pulmonology on the case, so I would review their recommendations. So I go talk to the patient, I see the patient, I do my clinical exam, I talk to my nursing, so whoever is the nurse taking care of that patient, because nurse information, I mean, they give a lot of information too, like, so we are there seeing the patient for, a few minutes a day, but nurse is the one that's taking care of that patient like 24 hours, right? So they update you on like a lot of tiny details that may help you in making a plan for that patient. So I talk to my nurses, and so again, army of people in the hospital. So there are like physical therapists seeing the patient, occupational therapist seeing the patient. There may be a dietitian seeing the patient. There may be a speech swallow evaluation, like speech therapy seeing the patient. So I review all their ancillary notes, and if there's something I need to communicate with them, I will communicate with them. I'll talk to them. And there's like a wound care, assessing their skin and wounds if they have any. So I talk to all the ancillary staff, and if there are any family in the room, I talk to them and update the plan of care. And if there's no family in the room, like I come back to my computer and I make a call to whoever is the assigned person for me to talk to in regards to that person, and I'll update their plan of care for the day. And there may be scenarios where, like, not every patient is simple, right? So, where you are so concerned about maybe this patient could be deteriorating if you don't do certain things, or you want to do certain things, like start him on a medication and see and await response to see how the patient is responding to that. So I, so let's say I'm giving patients some IV fluids for soft blood pressures. If the blood pressures are low, like, I give some IV fluids to the patient, and I recheck within like 2-3 hours to see if the blood pressure is improving, to see if my treatment is actually impacting the patient, if it's helping, whether I need to continue the fluids, or if the patient continues to stay hypotensive, which means if the blood pressure continuously drop, then I may have to make a change in plan. Like maybe I have to send this patient to ICU, like it's more critical, like so I'll be constantly reviewing the patient's chart and constantly following upon them to make sure what's right for the patient. And towards end of the day, like once I'm done with putting orders and all, um, I'll do my notes. So for each and every patient encounter, we have to document what's going on. Like we have to come up with the assessment and plan. So we document our notes. Notes takes longer time. So once we're done with the notes, I'll we circle back on if there's any. So let's say in the morning when I saw the patient, I ordered a chest X-ray on a patient. So before going home, I wanted to make sure if the chest X-ray is back and see if the patient has any worsening pneumonia, or like if there's any worsening fluid, I have to act on where I need to prescribe a medication to help take care of it. So I'll do all those before I come home. Um, yeah, so that's my typical day.
That's a very busy day.
It is a busy day. That's why we get to take a week off. It is,
Yeah.
yeah.
So another member has a question on what would you recommend for high school students who want to prepare for the rigor of the doctoral pathway, such as medical school?
So medicine is like a marathon. Like being in a medical field, being in a medicine medical pathway is like a marathon. You build your endurance with compassion, empathy, good listening skills, being kind, having good bedside manners. Like, you build all those. End of the day, it may be like after the race or end of a stressful day, you feel like you're physically broken. Like, after a stressful day, you feel like you're broken, but your spirit is still high, like you're still soaring. So that happiness, that gratitude will pull you through the troughs. Like, everybody in their life, like not just medicine, any field has peaks and troughs. You just have to understand yourself, when to bring yourself up. So I think by practicing all these, the gratitude and the happiness and the satisfaction you get after helping a patient will pull you through all the obstacles you may have, you may experience. So the rigor would be, like I said, you build the endurance with, long hours. Like you have to be having these basic qualities for you to be a doctor. Doesn't matter what specialty, but having these qualities would make you excel in any specialty you choose.
Another member also asked, how does this job or field affect your general lifestyle?
So again, it's what you choose, right? So my personal lifestyle, this perfectly works for me. So during my week off, I take my time off to balance my personal life. Like, I go for a run, I go for a hike, I take care of my home stuff, during my week off, like, kids, family, cooking, whatnot, so I have a good balance of a week on, week off lifestyle with the hospital medicine, and I really enjoy it. Um, and some people may prefer having all weekends off, it's their choice. You can choose to do that, but then most of the hospital schedules are week on, week off, or maybe 5 days on, 5 days off, which includes a weekend. It's just, you have to find that balance between your work and personal life. So once you know how to maneuver that, I think people will really like it.
So, talking more about your career, is your field something that you will have to learn continuously throughout the years? So, are you continuously learning many things from your field?
Yep, medicine is a lifelong learning process. It never ends. Every day you learn something new. Medicine is vast. It's impossible. It's not like a data where you store everything in your brain. It's not going to happen because medicine is constantly changing and the technology is changing, and you should be open-minded in accepting new things into your life. Then only you can survive in this field. It's a constant changing and learning process. And for me, most of my learning comes from patients. Like, you talk to the patient. Like I said, it's not black and white. Like in textbooks, you learn something where you learn about like pneumonia, right? Like these are the signs, symptoms, clinical features, and the diagnostics. This is what you see on the chest X-ray, right? But patients are not that typical. They don't come with that textbook picture. So when they come in with shortness of breath. But the shortness of breath could be from multiple reasons. It could be sleep apnea, it could be pneumonia, it could be a fluid in their lungs from heart failure, and most oftentimes the patient population we see, it's a combination of all three. So it's like a lot of gray zone that you need to focus on. That's what you need to keep learning. And you learn that with experience, and once you're experienced in your field, it's just that intuition, like you can tell like what's wrong with this patient. Yeah.
Yeah, I think experience makes it more, you become a more of a professional through it.
Right, right.
So, were there any other specialities that you wanted to yourself to perform other than being a hospitalist?
Yes. I don't, most of the people, I'm just giving you some non-traditional answers here. Like most people, like, they say, oh, I envision myself as, so and so specialty since I was, in my school or, in my med school. Um, I never envisioned any specialty. I never, going back, like, I never thought I would be a doctor to start with, but I always had the traits of, being a physician. um yeah, I mean, it's I explored my options, considering other fields, like after residency. So I was trying to see, like, is my choices primary care, outpatient, or hospitalist, or do I want to do any fellowship? And I explored my options, and my fellowship options at that time for me, being a board certified family physician, was emergency medicine, sports medicine, obstetrics and gynecology, or palliative care medicine. And I liked all of them. That's my problem. Like, I like every specialty I rotated with, and I couldn't imagine myself doing one particular thing. So that's why I picked hospitalist.
Yeah.
And even in hospitals, like, so our, in Northside, at least in Northside, we have all our floors are like designated specialties. So let's say, one floor is all neurology patients, two central is all pulmonary patients. We have ICU on one floor, we have cardiology on one floor, we have PCU on one floor, oncology, surgery, everything, ortho, everything is like separated. And even till date, I'm just like, because it's most of my thinking is retrospective, right? So even till date, if I have, like, out of my 18 patients, if I have like more than 6 patients on oncology floor, I can't handle it. It's like, it feels like too stressful, like, I don't want to stick to one particular thing. I like, just hopping from a stroke to pneumonia to a heart attack, like hip surgery, like, I just like that variety, even in my current setting.
That's cool.
Yeah.
So, another question we have is, what out of school extracurriculars would be useful to show colleges interest in healthcare?
Out of school extra, are you asking about myself or in general?
In general, anyone who's interested in medicine
Okay.
or your field, anything in the doctor field.
Okay. So most oftentimes, in general, they would look at, you don't necessarily have to be in, like taking biology major or like, any kind of like this major science majors for you to be going to a med school. One of my colleague that I'm working with right now, he did his engineering like at Georgia Tech, and but he's in medicine. So it doesn't necessarily have to be all the science courses. It could be any arts, language, could be like history, any of the majors you could do. But what they look at is, so let's say, I mean, I'm just talking out of my own personal experience, interviewing candidates. Like when I was doing my residency, like, we were in the interview panel, like, selecting the candidates. what we would look for as a team and my program directors, like what they're looking for in a candidate is this. Obviously, everybody who are going through the medical field, just definitely they would be having some good grades. Um, they would be volunteering or shadowing, at some level of specialties, like, they would be working just to get some exposure. What we are looking at is, apart from these, like, you just have to be a genuine, honest person. You should be a good team player. Um, you should get along with anybody. You should be open to learning. I feel like most people like lose themselves trying to get into the aspect of like, oh, I need to get good grades. Like I need to get straight A's. Like you don't have to be outsmart. Like, you learn things. You don't have to be like straight A's to get into medicine. You just have to show yourself that unique quality being as just being a human being. Like, so what's your unique quality? What are you bringing yourself to the table? Like, how compassionate you are, just the life experiences. That's what I suggest. Try to get as much experience as you can. Like, just volunteer at some health. There are like so many health fairs around, like, medical camps. Just volunteer at one of these places to see. I mean, I volunteered at, before my residency, I volunteered at Grady Memorial. I was just like literally cleaning beds and moving the stretchers, and so it doesn't have to be anything related to direct patient care. Just volunteer somewhere, show that you are interested, and during this process, you develop that compassion and empathy, being a good team player, like, so you develop these qualities. That's what stand out the most.
Great. Thank you so much for your Dr. Avila for your time. This was definitely really helpful, like to me, and I'm sure to other members too. To close out our event, we'd like to thank you all for joining this conversation and to making it interactive.
We're gonna leave a QR code up for attendance, so make sure you scan it, and it will be turning off tomorrow at 4 p.m. This video will be posted on our YouTube channel soon, so make sure you guys check the video out in case you want to learn more. Thank you guys for joining. We really appreciate it. We hope you have a great night.
Good luck to all HOSA members.